Good morning, I'm Daynelis Sanchez, an RT student from Miami-Dade College Medical Campus. Today I'll be making this video on how to perform trach care. Trach care is important to maintain the skin's integrity and avoid infections. Trach care is indicated for all patients with a tracheostomy tube. There are no contraindications for trach care, but there are some possible hazards such as tachycardia, hypoxemia, atelectasis, bleeding, and possible respiratory distress. I will now check the patient's medical record and verify physician's order first. I will knock on the door, come into the room, introduce myself to the patient as an RT student, and explain the nature of my visit. At this time, I will go ahead and perform hand hygiene for at least 15 seconds and don my non-sterile gloves. I will now check the patient's identity using date of birth and medical record. And now I can gather my equipment. For this video, I'll need a tracheostomy care kit, a BVM, and a suctioning source. I will now position the patient in semi-floater's position. And I will assess the vital signs, heart rate, respiratory rate, SpO2, and breath sounds. If I hear coarse crackling, I will suction the patient before, and I will oxygenate before and after suctioning. I will now go ahead and open my tracheostomy care kit using aseptic technique. I have my sterile field. The part I'm touching is the part that I'll place on the bottom. I'll place everything that is in here onto my sterile field. I have hydrogen peroxide, sterile water. I'll mix them together and I'll place just sterile water on these two over here. I have my tracheostomy tie. Some 4x4 gauzes, a pre-cut 4x4 gauze, a brush, and Q-tips for the hard to reach areas. I'll now place my sterile gloves on top of my non-sterile gloves. Like so. I will now go ahead and remove this old 4x4 gauze. Remove the inner cannula. Dip it into the hydrogen peroxide and sterile water solution. Brush it. Cleaning the inside around it. We can dip it into the sterile water to rinse it, tap it, and set it aside to air dry. We can grab one of the 4x4 gauzes, dip it into the hydrogen peroxide solution, and we can clean around the stoma area and the outside of the tracheostomy tube. We can use the Q-tips for the hard to reach areas. We can dip it into the hydrogen peroxide. We can clean around it. And now we're gonna get another 4x4 gauze, dip it into just sterile water, and rinse the hydrogen peroxide because it can cause skin irritation. Now I'm gonna go ahead and place the clean 4x4 gauze just to make sure that everything is dry and neat. I can now change his old and dirty necktie. Always holding on to the flange. We don't want it to move from where it is. Secure it around the patient's neck, not too tight. Remove the other side. And we can go ahead and readjust the pre-cut 4x4 gauze if it got moved. Now I will reinsert the inner cannula, lock it into place, and I will reassess the patient's vital signs, heart rate, respiratory rate, SpO2, and breath sounds. And we're going to make sure that we have airway patency. At this time, I will remove my sterile gloves. Remember, I have non-sterile gloves on the bottom. We're pretending. I will clean out my area. Throw everything away, ensure the patient's comfort, and before I exit the room, I'll wash my hands, remove my non-sterile gloves, throw them away, wash my hands, and document all the information on the patient's chart. This has been a how to do video on tracheostomy care. Thanks for watching.